This is ANN News Brief.
Zimbabwe government says it has shortened an overnight curfew imposed to combat the coronavirus pandemic and has extended business hours despite rising case numbers. Zimbabwe has recorded more than 5,000 coronavirus cases and 135 deaths. Business hours have been extended to 4:30 p.m., while the overnight curfew will now start at 8 p.m. Some officials fear a complete removal of restrictions on movement would cause a spike in infections and overwhelm the nation's health sector that is already collapsing as a result of strike actions by medical workers, lack of medicines and protective gears. An armed group loyal to the Libyan warring general Khalifa Haftar has announced a partial lifting of its 8-month blockade of oil fields. Factions loyal to Eastern Commander Haftar began the blockade of oil terminals and fields in January, putting a reduction in national output to fewer than 100,000 barrels per day from around 1.2 million barrels per day. The blockade that was intended to put economic pressure on internationally recognized government based in the capital, Tripoli, has caused power cuts and cost Libya more than $8 billion in lost exports. The reopening of the oil installations will allow the sale of oil already stored in terminals, but not the production of fresh supplies. We'll be right back.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Rwanda is examining COVID-19 impact on psychiatric patients, some of whom are reported to have relapsed, mostly because of neglect and improper treatment amid the coronavirus pandemic. Psychiatrists in Rwanda say efforts have been stepped up to prevent the spread of COVID-19 and to protect patients. Administrators at psychiatric hospital in the capital, Kigali, say one of the effects of the COVID-19 pandemic has been an increase in the number of patients going in.
We test them very often together and we know how they stand. We don't put them together with the newcomers or the visitors, and we don't let visitors get to them. No visitor is allowed except when necessary during the patient's treatment.
The department that specializes in dealing with drug addicts at the Indera Hospital, as well as those affected by trauma, says drug abuse is the main reason for high numbers of patients being admitted lately. Numbers of patients rose from 44 in April to 75 in June. That is ANN News Brief at 4. Join us again at 5 for our full newscast. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I'm Lucy Adeyemi.